happy FriendsDay Wednesday. Thanks so much for joining us. I am so excited. I get to sit here with my friend Chris Chapman. Um, for those of you who don't know, I'm going to tell a story, Chris.
Go for
Um,
it. Go for it.
we were at the retreat in Georgia. We always have a great time in Georgia.
Yeah.
And one of the reviews said I could listen to Chris's voice all night long. It's as smooth as butter.
Butter. Yeah.
So so now we just call Chris Butter because his voice is as smooth as butter. Is that right?
Hey, that has been a representation for a while.
Somebody certainly did like your voice. We don't know who it was because it was all anonymous, right? But that's what they put. And that name is just stuck for you.
Hey, I'll take all the compliments I can get.
Oh goodness. Well, right before we started, we chatted for just a few minutes about what are you doing on Saturday?
So Saturday we are going on the Coding in the Caribbean cruise.
Mhm.
So we're going to be flying out Friday to Miami, and then heading out or embarking on Saturday. And that is a great opportunity for anybody who wants to go out, learn coding, and also experience the Caribbean, some of the stops that they make as well. So the format is while we're at sea. Usually when you're at sea going between ports, there's a lot of downtime, things to
Right.
kind of go around the cruise ship, do festivities, things like that. And so Christine Hall has put together, I think she actually inherited it from somebody. She actually took over from somebody. Um, so she's kind of hosting the Coding in the Caribbean, where you can actually go meet and network with people who are in our field, coding and compliance wise, and excellent courses, excellent information. I attended the one last year and walked away with a lot of information.
Good.
Um, and a lot of good scenery as well. So if you're looking to combine vacation with learning and business potentially, those are all great opportunities with it.
Nice. Now, you and I just came back. We were together. Wink, wink.
Yeah.
Where were we together in December?
So December we were at the NAMUS conference.
Yeah.
That's another great organization that teaches compliance and coding. Also great places for social networking. And that's one of the benefits, in the COVID and the pandemic,
Right.
we were having to work remotely. And, to me, the social aspects is always the most important part with any coding compliance, because what's going on in Arizona, what's going on in Georgia, what's going on in New York, they are on opposite corners of the country. But what goes on between them affects all other areas potentially.
Right. Well, and I would say not just for social, um, but I can tell you, and because you were part of these, like we have great conversations. Just those happen naturally when we all get together and we're all just
Yeah.
sitting around having lunch or supper or walking to somewhere. There's just natural conversation that happens. Hey, did you know? No, I didn't. Did you know? And it just continues. So I absolutely encourage people to attend the ones, but you want to make sure that they're, I'm going to say, legitimate, that they have the quality of education, the quality of content, the quality of speakers. Um, and sometimes I don't know about you, Chris, but I have to pay for that, right? Um, so you have to put your money where your mouth is. Like I have to invest in myself to get that education that I need to be who I need to be for my role, right? So sometimes it comes at a cost, but it's great payout. You get the education, and then you get to network and rub elbows, literally with all of these people. And when we were at NAMUS, Shannon DeConda is right there having conversations, and she's available to have conversations with people and attendees. That's priceless.
It is. I mean, you're going to get experiences from people who've been in the industry for, not just 1 or 2 years. They've been in the industry for a long time. And, healthcare is one of the spaces where, you know, even people that have been here for 40 years can still teach people coming in new tricks because they don't teach a lot of the stuff in schools nowadays.
This is true. That is true. So let's back up, because you had said something about, what happens in New York is different than what happens in Arizona, than what happens in Georgia. But you have been very, I'm going to say instrumental. You have been very attentive, maybe is the word. Because you and I've had some conversations. You were very interested and I'm going to say glued. That's not right. But you were really focused on what was happening with the United Healthcare Congressional.
So part of my functions in the office are, for those who are not familiar with the first credential in my name, the BSCS. So that's a Bachelor of Science in Computer Science. So my background starts in technology. I started software development, support, and migrated through different industries. And so at the office, while I'm working with Carlene Dietrich with, billing for surgical assistants, also going around and doing seminars on ERISA and compliance. Mm-hmm. One of my jobs is to be the cyber professional in the office and the compliance officer. So back in 2024, in February, there was a massive cyber breach that most people in healthcare are aware of. It happened with Change Healthcare, which is one of the clearinghouses, the main clearinghouses. And recently, during the COVID pandemic or shortly thereafter, Optum, which is the child organization of United Health Group, had bought Change Healthcare. And over the course of 18 months, they were administering it. And unfortunately, they were the victims of a cyber attack by a large hacker group.
Right.
And one of the biggest things that brought about it, because it impacted so many people. So United Health Group also owns United Healthcare. Mm-hmm. They also offer over 100 other different affiliated insurances. And because it's a clearinghouse, Change Healthcare was also routing traffic through some of the major payers, including Aetna, Cigna, and several other payers.
Right.
In fact, one of the few ones that are not in there are Blue Cross, some of the Blue Cross Blue Shields, because they usually go through Availity. But so when Change Healthcare went down, for those who are not aware, when, let's say if you're in your office and there's a cyber threat that is found, the network engineers or the network staff at your office will not wait to come around and ask you politely to turn off your computer. Mm-hmm. They will come around and yank out the network cord, or they will turn off the network.
You're done.
I was actually in an office, ironically, at an insurance company that I will not disclose, but this happened where the network staff person came over to one of our team members, and literally reached over his shoulder and unplugged his network laptop.
Wow.
Didn't have a conversation with them. He just reached over and unplugged it.
Okay.
So that's basically what happened with Change Healthcare. The company turned off the entire network. And consequently, if you were doing transactions on that weekend or Monday, some people are saying Tuesday, but we found we have started seeing transactions drop on Friday. The Friday before. When those went down, if you're trying to submit claims, trying to do eligibility checks, trying to get ERAs or electronic remittance devices, that went down. And it went down for a long time until they had their network rebuilt back up. So it's not just a simple matter of remediating this particular device. They had to reconstruct and rebuild their entire infrastructure, or at least for the server infrastructure. So one of the congressional committees that's in the Senate decided to take note of that and perform an investigative review of that to see why it happened, how the attack happened, why it happened, and why there weren't safeguards in place to prevent it. That particular committee that did that was the U.S. Senate Finance Committee that investigated that. And so they really grilled the previous CEO, Sir Andrew Whitty.
That's his name.
Yep. Whitty, yeah. Now, currently, the new CEO is it was a prior CEO, I think Stephen Hemsley, I believe.
Sure. I'll believe you.
But so they grilled him for about an hour and a half with questions on why the attack happened. And basically it boils down to they didn't have multi-factor authentication. So if anyone, most people are aware of what multi-factor authentication is you have a login and a password, and then you have to have some other form to get a second temporary code, either on your phone or your email or something along those lines.
Right.
Some people might even have those small electronic devices called fobs.
Oh, right.
They'll generate the password there. So the network administrators who were remoting in, or at least one of the network administrators, was not using multi-factor authentication, and their servers had not been upgraded to a point to allow that. And a hacker group, and not just one lone hacker, this is a sophisticated hacking group that went in and took advantage of that. And they actually gained access to the network. And because they had not properly segmented off that network, they were able to get access to all of the servers that were housing the data and then export out that data to their own dark web servers.
Wow. That's some pretty scary stuff. But when you talk about congressional hearings, sometimes we just tune that out because we're like, that's congressional. That doesn't affect me. I'm a biller, I'm a coder, I'm a compliance officer, whatever. Congressional hearings don't affect me, but that's not true, right? So tell me what it would be a true congressional hearing. Like, what does that mean?
Well, so to keep in mind, so our government model here in the United States is a constitutional federal representative democracy. So constitutional means there's a constitution that has to, that has the laws and, basically the contract with our government that tells how it forms, the limits of their powers, and also the rights of the individuals. It also separates out the branches of government. So one of those branches is is Congress. That's the legislative branch, and they can make laws. And the Constitution has given them powers to go to basically anything that's legislative goes under Congress.
Okay.
And one of those stipulations is that they make necessary and proper laws. So they can't make erroneous or illogical type laws, although sometimes you see things like that. But the intention is for the laws to make sense and to be necessary and proper. And so to do that type of function, Congress has to have the ability to hold hearings to perform different sub-functions. So these usually fall along a certain line. So they could be a legislative type hearing where they kind of go out and consider new legislation, get testimony. They can be in oversight capacity or investigative capacity. Now, that's what the Senate Finance Committee was doing. They were performing an investigative function.
Okay, because they were investigating what happened.
Yep. And now also the oversight usually involves reviewing some performance of government agencies, but sometimes these kind of overlap a little bit. And then also they could be confirmation hearings sometimes, like if you have a new Supreme Court justice being nominated. So where that applies to healthcare is obviously we fall under an industry that's heavily regulated, and those regulations stem from laws. So just because your insurance, just because your commercial insurance company is saying they can do something doesn't automatically mean that that's right. There's a law that they have to follow to render those benefits. And that could be Medicare law, that could be ERISA law, that could be part of the Medicaid statutes, and all the different areas.
Now, you're talking about these laws, and you talk about ERISA laws. And we're not going to get into that today. Like, we're not going to get deep into that. But if somebody wanted to know more about the ERISA laws or the laws that govern healthcare, they could, I don't know, randomly attend one of your seminars, right? And find out more information about ERISA and how that really truly applies, and how we should be holding the payers, the insurance payers, accountable. And make them adhere to the laws. They could attend one of your seminars and they could hear that, correct?
Yep. So Carlene Dietrich does a great seminar on term denials into dollars that goes over ERISA. And, basically for those who are not aware of what ERISA is, though, that covers employer-sponsored benefits. Okay. And for the commercial insurance market, that's a large percentage of what type of patients that we see in our practices and our hospitals day in and day out. So that turn denials into dollars goes over what those ERISA laws are. And now keep in mind, now neither Carlene nor myself are lawyers, but keep in mind that the law was not written for lawyers. Now lawyers do exercise the law, and it is a legal requirement for them to practice in certain formats, but to understand the law is written for everybody to understand.
Right.
And so for everyone to understand it, it has to be written at an 8th grade level.
Oh. Now if I wanted to, let's say, I mean, we're talking a word, ERISA. Some people have heard that and some people have not. So if I'm hearing this, where would I go to start looking to see if ERISA laws even apply to me?
Well, so you can go as far as getting out your insurance card, and if that insurance card is given to you through an employer-sponsored benefit, either through an employer or through a union, even if it's a small company, that
Right.
Let's say you have a small company of 10 employees. If that company gives you health benefits, then that is governed under ERISA.
But where would the ERISA laws be? Are they part of the OIG? Are they under the Federal Register? Like, what if I'm a biller and I'm like, I keep hearing ERISA, but I don't know where to find those laws. Where would I find the ERISA laws? Laws.
Well, so if you're going out on the Federal Register, it's under Title 29. And
so they could search the Federal Register and look for Title 29.
Yep, Title 29 CFR 2560 is the part that kind of goes over those with the ERISA.
Nice. So they are out there. People just have to know where to find them.
They're out there for people to read and understand, but how to apply those to the various insurance denial tactics, and keep in mind there may be a few denials insurance companies give that are valid. Right. If you're trying to submit insurance for a member that's not covered by that insurance, obviously that's not a valid claim.
Right.
If you're given a particular benefit, let's say to get a C-section, for example, and they're trying to deny that benefit and that's offered through the employer benefit, then that is a non-compliant denial. And so that, how to address those and get it to the attention of the people who can actually make the best enforcement of those rights. That's the trick with it sometimes.
And that's the stuff that you guys teach at your seminars.
Yep.
What's the website? So is there a website that people could go to if they wanted to find the schedule for 26, or is there an email? Like how could I find out the next time you guys are doing something?
Well, so you can go out to medrevenuesolutions.com, or you can reach out to either myself with my email address at chris.chapman@officeplexsolutions.com, or you can reach out to Carlene Dietrich at medrevenue@bellsouth.net.
Or you could reach out to me, and I'm happy to connect you guys.
Oh, definitely. Reach out to Beth, and then she can connect anyone to us. Generally, what we're doing this year is if we have a large interest, not necessarily a large interest, but just a couple, like 10 to 15 people who are interested in that type of educational seminar, we'll generally schedule one in a geographical area and hold it for anyone who wants to attend to it.
Nice. Well, I'm just going to throw this out there. I have a full classroom here in Phoenix, and you guys are always welcome to just come hang out, because then I get to see you. You're my friends. But what congressional hearings have you been listening to recently? And why should I know this?
Well, so recently the ACA subsidies have come up for termination as the ACA, the Affordable Care Act subsidies. So for those who aren't aware of what that is, so if you had to get, what's called Obamacare or marketplace insurance, for the past several years, you have had the option to claim a tax credit, and that would bring down the cost of your monthly premiums. Now, obviously, that's not that money that pays out those premiums has to come from somewhere, and that's part of what the tax credit was.
It's not just money that's grown on the tree?
No.
The insurance company isn't just forgiving me half of my, like somebody actually is having to pay that?
That is coming out of the general tax fund, yes.
Okay.
But now keep in mind, the purpose of that was to provide insurance for people who did not have the ability to, to pay several $100s for
Right.
insurance. But part of what was not advertised, or what many people may not be aware, if you go out and search for a marketplace plan, you are not getting a plan off the shelf that is like $100 to $300 premium like you may get from an employer. It actually can go all the way up from 500 to 800, and some people, with the loss of, they say, subsidies, we're seeing increases up to $2,000 a month.
That's amazing.
So obviously that generated a lot of news, a lot of interest in trying to get that continuing on.
Do you think this artificially inflated the cost for health insurance for everybody else? Because I don't know about y'all, but my premiums certainly went up significantly when ACA was mandated.
Well, so the cost of healthcare, this is one thing that a lot of people don't understand. The entities that are generating those prices are the commercial insurance companies. And one of the biggest blind spots in healthcare right now is the space between the employer funds that fund the employer-sponsored benefits, the commercial insurance companies, and the providers, the practice in the hospitals. That area in between where that money is changing hands is a very blind spot. No one really has access to that except for the commercial insurance companies. And so
it's nice to see that piece.
Well, so that is a very big part of what Congress is trying to get in a more transparent fashion. The president wants it. Congress wants that to be transparent. Because what we find a lot of times in multiple industries is when those doors are closed and no one's watching, there is always going to be a temptation for someone to take advantage of that. And, the question that's posed a lot of times in our seminars, if you go back over the past 10 years, our reimbursements as healthcare providers and practices and facilities have been going down over the past 10 years. The profit margins for the commercial health insurance companies have been going up.
Right.
So if they're gaining profit and we're losing reimbursements, where's the difference going to?
That's exactly right.
And so one of the questions we pose, in the year of COVID in 2020, when commercial health insurers were required to pay 100% of COVID cost, 100% of COVID care, and including the normal routine care that was being rendered to patients that normally is, how could they be recording double and triple earning profits?
Isn't that amazing?
So, so that's one of the biggest things they're really driving these congressional hearings right now is the affordability of healthcare. And one of the nice things I found in listening to these two these two House committees is how many members were going after these nefarious tactics that the insurance companies are doing. And it's if you want to watch, take about 2 or 3 hours or just separate out. You can watch in different pieces of it, and you can actually see how many different views are being attacked from those points of the members.
Wow.
At one point they were talking about the denial rates of prior authorizations, and they asked the United Health Group CEO this time, what's your current percentage of denials? And he was trying to claim that of all the cases, they only deny about 2% of the cases for United Healthcare claims.
Huh.
And then the lady congressperson was hold up a sign showing that there was about 30 to 33% from what they were finding.
Yeah, that seems more realistic. 2% seems awfully low. Like if you're in the real world, 2% just seems really low.
Very, very low.
Now, if I wanted to watch these congressional hearings, where would I find them? I would suspect C-SPAN.
Well, so you can go out to the committee website. So one of the committees was the U.S. House Committee on Energy and Commerce. They have a hearing calendar that you can go out to and click on the hearing for January the 22nd, and you can actually watch the pre-recorded or the recorded live hearing. The second committee was Ways and Means, and they also have a hearing calendar that you can go out to on January the 22nd and watch that hearing that's hosted on YouTube.
Very nice. Yay. Well,
And just to let everybody know, there is a point where they were having to go and you know, perform voting functions. So there's about an hour or two in the first committee that's kind of in a pause, and you can just kind of skip over. They come back, and both sides of the hearing are very good to watch. Uh, and then the Ways and Means Committee does the same thing. They had 2 votes going on that day. So
nice. Now, would it be fair to say that what happens in that hearing could affect us as billers, coders, auditors, compliance officers?
oh, definitely. So I mean, keep in mind they had each committee had a person of the electorate there, a constituent, and so
Okay.
each person was saying, if they lost the ACA subsidy, they were going to have to make some difficult choices, either to do away with health care. And keep in mind, back before the Affordable Care Act, if you were not making enough money or employed through an employer that provided health benefits, you had to make some difficult choices. You either
Right.
had to go without insurance, and patients who don't go to get care when they need to get care become sicker patients. And
This is true.
and this was the argument made by several of the congressional members. If they're not getting care timely, that it ultimately is going to drive up the cost of healthcare.
Right.
And ultimately, the providers, and I find most of the providers are not necessarily concerned about the profit margins. They're more concerned about the patient.
Well, they are. I mean, the good doctors, the doctors who genuinely got into this field because they want to be doctors to help people and to heal people. But they're still, well, some of them are still business owners in that they still have to cover their overhead. They still have to pay their staff and pay for their rent, pay for their building. They still have to cover that. I know that I have providers that are within pennies either way of reimbursements from 12 years ago. Those reimbursements haven't gone up much. Meanwhile, cost of living keeps going up. The minimum wage keeps going up. Before long, our providers are going to be working for less than minimum wage because their reimbursement isn't going up. But on the consumer side, my premium keeps going up. But my provider isn't getting paid any more money.
Yeah.
There's a disconnect somewhere.
Yeah, and that disconnect is in that blind spot area. And so that's one of the things we really need to be, when someone is asking what good is a hearing committee or what good is our congressional representatives, the point is that they are there not for the interest of the insurance companies. They're not there for the interest of the big conglomerates. Our representatives are there for the individual, for us. And it's important that we engage them. And even if we're engaging our local representatives, our state representatives, our congressional representatives, it's important that they understand where we're at financially, because, if the practice goes under or the hospital goes under, where are people going to get the care? And
That's right.
unfortunately, right now, there are hospitals that are closing. There are practices that are closing.
Mm-hmm.
And when you go to Midwest type states, they have some cases where you have to drive 2 hours to get to a hospital.
Wow.
And all it takes is 20 minutes for an emergency to become past the point of recovery.
Right.
Unfortunately.
Yeah, it's hard for me. I mean, I live in Central Phoenix, and I mean, I could probably throw a stone. I won't, but I could probably throw a stone and hit probably 4 or 5 hospitals. But I know exactly what you're saying. I will not disclose things, but when Gary, my husband, had COVID, we dropped our son off at Camp Pendleton, and he said, I need to be in a hospital. And I may have driven fast, but coming across that desert, there's nobody, there's nothing, but there's little populations of towns. And so you think, where is the nearest hospital? If you're out in the middle of the desert and where's the nearest hospital? We did the Polar Express with our children years ago because they're adults now. And my son touched a shrimp to his lip, had an immediate allergic reaction, and I'm panicking. I am 40 miles from the nearest hospital. What happens when people have these life-altering emergencies and they're 40 minutes, they're 6 hours from a hospital? Like, what, how do they do that? And you're right, with all these hospitals closing or practices going under, it's affecting the patients and their care, and some people are not comfortable going to the big city to get their care. They want their small town doc that they've always gone to, and that small town doc just can't afford to be open anymore. So that
Yep.
affects their choices. So, wow.
Yep.
Well, Chris, I have had a great time. Thank you for being my friend. Thank
Yeah.
you for joining us
Always
today.
great to talk with you on these things and be friends with you.
Yay. Yay. Thanks for being my friend. I'll pay you later.
And also, one thing that we didn't talk about was the coding retreats that you've hosted in the past,
Yes.
and that also brings the point to those social opportunities, because it's a small knit type group that's able to have conversations, and I'm not big, I'm not knocking down the big function type areas like
No.
may do or anything like that. Um, there are social opportunities there, but the benefit of the smaller type events like that, and like NamUs, and like Christine's cruise they're happening, is it gives you more time to socialize and go between the different functions and activities,
Right.
and also interact with the speakers as well.
Well, and so we're doing a reverse retreat, and that's what I'm calling it. But and I think I have you on the schedule to speak. So it's going to be in June. That's going to be a virtual retreat. It'll be a reverse. It's kind of like a staycation. It's going to be a reverse retreat. You guys stay home, and everything will be virtual. We're kind of thinking about maybe doing an actual in-person retreat in October. We'll talk a little bit more about that. But yeah, that's the intent, is that you go to AAPC, and I love going to HealthCon. I love going to AAPC, but it's big, and for some people, that's just overwhelming. To be with 3,500 of your closest friends, that's a lot. And Betty and Hovey and I have had the conversation, like, we're up here speaking, and there's a line of people that want to talk to us, and I can't speak to anybody because I have to hurry up and get my stuff and go to my next session because it's starting in 15 minutes. And I want to talk to people, and people want to talk to us. And it's important that we have that, because otherwise I'm just somebody on the stage. Betty Hovey is just somebody on the stage, but maybe Betty has great content, or Chris, you have great content, and we need to have those conversations. But then they're lost in the sea of people, and that's really the intent of our retreats, is that they're not lost in the sea of people, that you then get to sit with people, you get to have those conversations. We sit at the same table for lunch and dinner and breakfast, like we're all together, and we're literally all together all weekend, and everybody gets to interact with people. And that's the goal of our retreats. And yes, we'll have some this year, so be looking for them. Yes, Amy Wheeler has come on them and has had a great time with them. And Amy, we'll get to see Amy in a couple weeks. So Chris, I appreciate you coming on and visiting with us today. I'm a little jealous that y'all are going on the cruise, but not so much that I am going to go on the cruise. I'm a little worried about seasickness, to be honest.
Well, now I don't know how you get around, but now Carlene's got a nice. I used to get seasick on cruises too, and she's got a patch that you put on that it solves that.
Nice. Yeah, I think Lexi's going to work on some stuff for me, so we'll see about going for next year. But we'll see. Fingers crossed. We'll see if that happens. So, but you guys have a great time on the cruise, and I will see you. If nothing else, I'll see you in June at our reverse retreat.
Definitely. I look forward to it.
Perfect. All right. You have a great day. Thanks, everybody.
All right. Well, thanks for the opportunity, Beth.
Thanks. Bye-bye.
All right. Bye.